Hey Jen,
Hey
nice to see
Stuart.
you.
Yeah, good to see you too. How you doing?
I am doing well. So I think today we are discussing acute COVID, and really everyone and their mother around me is getting COVID right now. Right now it's mid-September, and things are flaring. My neighbors got it. I got lots of kind of friends who've got it. And so I think that we're going to talk about what would I do or what would I recommend to my patients if they were to get acute COVID. I think the underlining thing is preparation beforehand, and to make sure that when COVID strikes, that you are in a position that you can properly help yourself.
Yep.
So yeah, so Jen, what would you do if you were to get COVID?
Yeah, so I'm gonna second that on the preparation. I've definitely ordered quite a few things ahead of time, just like because I agree. A lot of my friends, family members, stuff have gotten COVID recently, and it's just, no matter how hard you try, sometimes you can still get it. It's the most transmissible pathogen so far on Earth, and so you can still get it. So I've definitely stocked up on quite a few things ahead of time. So things like certain like nasal sprays and oral rinses, antihistamines, various things that I wouldn't want to have to order and then wait for while I'm acutely sick.
Mhm.
Yeah, I mean, my kind of taught, I tried to kind of go through a lot of the literature. So I've been sort of following this for a while, put together a protocol where got like all the research there. My biggest thing, I would definitely try to get Paxlovid for sure. There
Mhm.
are some data out there showing that it may reduce the risk of long COVID. For me, I have some risk factors that put me at like higher risk of severe COVID, but um, that's actually not my biggest fear. I've been vaccinated several times. For me, it's more I don't want to get long COVID from this thing.
Mhm.
Um, that's
Yeah.
my biggest worry. Now, some people, it may be more so that, like, hey, I've got major risk factors for severe COVID, and that is more the risk I want to mitigate. But I think in both cases, there's things that actually seem to work across the aisle and help both. So Paxlovid is one of them.
Mhm.
Trying to get that, even like it was approved that pharmacists can actually write Paxlovid for you if you have acute COVID. I know some pharmacies it doesn't sound like are participating in that, but urgent care, your primary care doctor, you could even possibly have someone write a prescription for you and just have it on hold in your chart. So, meaning like you don't fill it, but that way, if you get acute COVID, you can just call in and they can just send it in quickly for you so
Mhm.
that there isn't much of a delay. Because usually you really need to start Paxlovid within 5 days of your first symptoms or your positive test. Um, the other one that is more so for long COVID prevention, but also there may be some mortality benefit too, is metformin.
Mhm.
Metformin, typically diabetes drug, it's dirt cheap, been around forever. And some people actually use it for longevity and anti-aging. And that one, there was a study done that was actually like it was randomized, and they were looking at several different drugs and if they impact risk of long COVID. Metformin actually seemed to drop the risk of getting long COVID by about 42%, which is pretty dramatic. So
Mhm.
to me, I've tried metformin before and it definitely gave me like diarrhea and upset stomach, which is a side effect of it. But knowing that it would lower risk of long COVID by 40%, that might be something I'd actually put up with.
Yeah.
Um, yeah.
Yeah, no, I agree. And so I'm going to jump in here and kind of comment on the Paxlovid and the metformin. So I guess I'll tackle Paxlovid first, which is um, it's a tool to help, and really being prepared is, I think, the most important thing. There are other options that are available. So something that I did want to bring up would be something like Tolovid. So Tolovid is a supplement that you can buy online that has 3CL protease inhibition. So it is something that's available if you can't get Paxlovid. I kind of like reminding patients like being prepared is important, because if you contact your doctor, your NP or your PA, and you ask for the drug, it might take a day or two. There might be kind of hiccups behind all of this. So it really kind of being prepared. And if you're kind of more on the natural side of things, there are other options available for people that do have some anecdotal evidence. I can't really speak to the efficacy of Tolavid. I haven't done the studies, but I know that I've definitely heard that it works in some people. So that's definitely something I wanted to bring up. Number two is metformin. Metformin is probably my favorite drug. It is a great medicine. I will tell my patients that it's probably the most prescribed drug that I've used. It is very cheap. It comes from the French lilac. And in addition to reducing long COVID, in a paper in the New England Journal of Medicine, which is considered to be one of the most prestigious journals, it did show a benefit in secondary outcomes of reducing hospitalizations and severe and ER visits. So, really good drug. I do tell people watch out for the stomach issues, but I actually take this medicine for other reasons. I used to give this drug to prevent diabetes and pre-diabetics. It leads to 5 to 10 pounds of weight loss in some folks over a long period of time. And again, as Jen mentioned, it people use it sometimes in longevity. So really what I tell people is if you've got people using it to try to extend their life, like probably not too risky, has good data out there, and is a good drug.
There's a couple places where you can get it online through anti-aging companies. Like I think Ageless RX can prescribe it remotely. I believe also like it's called healthspan.io also has it, if I remember right. So if you're, if you can't really get it or something, but remember, even if you go through something like that, it's going to take a couple of days to get through the process and get it shipped to you and stuff. So generally speaking, you'd want to have like a plan for that ahead of time.
Yeah. No, I agree. And I did check Ageless RX actually this morning for metformin at $25 a month. Definitely you can get it cheaper if you plan ahead. So again, another reason why to do this a bit quicker.
Like you'd have an emergency earthquake kit or tornado kit or whatnot, depending on where you live, have an emergency COVID kit. Get this stuff ahead of time. Have a plan. Ask the questions of your doctor, your pediatrician, whatnot, ahead of time so that you're not scrambling to figure this out when you're acutely sick and feel really bad. And so really the thing is, if you're mostly young and healthy, yes, you can still die from COVID, but your bigger risk at that point is long COVID. And don't take that risk lightly. We treat long COVID patients, and it is amazing. It's taken marathon runners, hardcore athletes, people who were not winded running like 10 miles are now winded walking up one flight of stairs. And this was within like 3 to 4 weeks of having this virus. So it's not like they were just deconditioned. You don't drop from a 10-mile runner to I can't walk up a flight of stairs in 1 to 2 months. It takes a lot longer than that to decondition, and they've done studies that show that it's not deconditioning. So really, it's roughly on average 10% of people, so 1 in 10, will get long COVID after a COVID infection. And it's not like, and we don't know like repeated infections. Does your risk go up if you've had COVID now your 5th time? We don't know. Vaccination does seem to reduce your risk of long COVID, but it reduces it a fairly minimal amount, something like maybe about 15%. It seems like it does stack though. So the more vaccines you have, it keeps kind of adding on to the risk reduction, but it's a fairly like minor risk reduction. So compared to like metformin taken during acute COVID. So just don't underestimate long COVID. If you can help reduce it, even just adding metformin, if you can't even get Paxlovid or Tolavid, even just metformin, just reducing that risk of long COVID, because let me tell you, you do not want that disease. You just don't.
Yep. I gotcha. Well, thanks so much for chatting, and I enjoyed it. And hopefully we can help a few folks avoid getting long COVID and doing okay with their acute COVID. And have a good rest of the day.
All right. Thanks, everybody.
Adios. Bye.
Bye.